Welcome to another episode of Winning Healthcare Food Fights Without the Mess. My guest this week is a board-certified family medicine physician and now practicing for over 15 years. She graduated from Kansas City University of Medicine and Biosciences in 2005. Her practice is Priority Care PC in Charlotte, North Carolina. We're going to explore some underlying reasons why you want to own your patient relationship, what it means to your care when you or your family is hospitalized, as one example, and how to get it. Welcome to the show, Dr. Melissa Jones.
Well, thank you for having me. I really appreciate this opportunity.
Well, let's dive right in to your new practice. How long have you been open now?
I have been open for just about 3 months, so not that long, right at the beginning of the journey.
Right at the beginning. Any entrepreneur can appreciate what you've done taking this risk, and I commend you for it.
Thank you. It does take a little bit of bravery to take the step toward it.
Yeah, I'm a serial entrepreneur. I know the feeling. So
okay.
You're at 1204 The Plaza. The street name is called The Plaza. So there's no avenue or street after it.
No, it's a special road. A lot of people around here know exactly where that is. And the neighborhood is actually Plaza Midwood. So getting that street was fortuitous because I want to be the neighborhood doctor. So the address in itself kind of presents me that way, being on the plaza for Plaza Midwood.
So you chose this building because of, and by the way, it's a nice looking building. So why that location? Was there something special about it?
Well, it is less than a mile from my house. So I wanted to make myself very accessible to my patients. And it's interesting, the ones that have come now aren't necessarily within a 5-mile radius. They're actually coming from by word of mouth even further away. But the ultimate goal was just to kind of be able to treat the people that I live with and interact with on a daily basis, and also make it not be a burden if someone needed me quickly. And if it's less than a mile from my house, then I can get there for urgent type needs, where if it was, a traditional practice that was a little bit further away, I might not be able to do that.
Sure. Yeah. Logistics is a big deal. If you live in Panama,
Right.
you know logistics because of the canal, but it's also important with medicine. And it's not just you being able to get to the office, but it's also your accessibility as a physician. And
Right.
Another thing I wanted to compliment you on is your website's name is simple. And I love that. It's melissajonesdo.com. So who came up with that?
So a patient that followed me from where I was before, she was very excited for me to open my own practice and just offered her help. And I hadn't even realized that she had a history of marketing in her past, but she brought that up, and between the two of us kind of throwing ideas with each other, we came up with that.
Oh, they deserve a gold star. That's excellent.
Thank you.
It really is excellent.
Thank you.
And I'd add that's where listeners can find out how much patients over 100 years old pay for a membership fee. So don't say it. Don't say it. We want to go to the website.
Okay.
That was very well played. So again, I commend you on that because I love these little things that make businesses their own. So
right, it has a little bit of personality. Yes.
Yeah, exactly. So let's take you to the first day you've opened. You've done all the preliminary work. You go in the morning and you put the key in the door, you open it, you go and you sit down at your desk, and the first person walking through the door sees you and thinks, where's the doc? Where are the back office people? Because that doesn't happen in the old system. How did they react? The first people coming through the door?
Well, they had a lot of interaction with me before they even got through the door. So I don't think it was quite as much of a surprise. And I greet every patient that comes to the door just to make sure that they can find it. I usually text them right before and give them my cell phone number so that they can call me if they're having trouble with parking. So it's not quite a shock. But yeah, to walk into my intake room where I do the history, And I offer coffee, tea, water, hot chocolate. It really kind of throws them off a little bit, that special treatment that they're getting right away.
And you answer your phone, right?
I do.
I mean,
The website comes to me, the phone comes to me, pretty much any kind of communication goes directly to me.
What's the typical reaction from patients with all of this?
Well, when I was in a bigger system, I gave my phone number to quite a few of my patients anyway, just because it's easier for me to answer their questions after hours than to have my partners take calls on them and not know any of their history. So some of them were just used to this. They're not necessarily thinking that it's anything special. And it was good for me to do this model, having already experienced giving my phone number and being available 24/7, because I realized when patients can get in touch with you, they don't really bother you at inappropriate times. Or if they need to, which, occasionally one does, they're very considerate. They're very almost apologetic that they have to bother you, but it's not a burden because they don't worry that they're not going to get in touch with me, so they don't call at 1 a.m. for something that they just need an appointment for the next day.
Yeah.
They tend to still call between business hours, even though technically I say I'm available 24/7.
Yeah.
And actually, with the millennial generation, they tend to text more, which also works well for me too.
I'm grabbing a drink of water because it's a little hot in Panama at the moment.
Sure it is.
Yeah. And I have DPC here, and I know what it's like to be able to text my doc at 8:00 at night, and I don't expect an answer from him. Sometimes I get an answer, sometimes I don't. That's okay. But it's the respect for time, because you respect their time too. You're there when, you say, well, come on in at 8, and there you are. And there's no 20,000 people in the waiting room either.
Exactly. That was probably my biggest frustration being a traditional practice, was that I myself am a very impatient person, but with that impatience, I'm also very efficient. So I would really try hard to see every patient on time, because I don't like to wait, and I don't want my patients to have to wait. They already don't feel well. They've already taken off work. They're already inconvenienced. They've gone through all the barriers to get to me. The last thing I want to do is make them wait half an hour, anything in the waiting room. So I really love this model because I can schedule the appointments, especially the new ones, for at least an hour, so that everyone has as much time as they want. It's very unhurried, but yet I can be on time and respect their time, just like you said.
Yeah. So what did you think being a DPC doctor was going to be like, and what is it actually like?
So I thought that being a direct primary care doctor was going to be a good relationship between my patient and I. And I'd already experienced some of that because I'd given my phone number to a subset of my patients before at my old practice. What I did find that was surprising was that my patients started coming to appointments more and were actually utilizing their healthcare more, because we took away a lot of the barriers that the traditional model of healthcare has. So, for instance, because they pay a monthly membership that's low fee, they don't have to worry about giving their credit card out or having their money ready when they come to the front desk type thing. It's just me. There is not a nurse or a medical assistant that's going to ask them a bunch of redundant questions, like the health maintenance questions of when was your last colonoscopy, when was your last mammogram. They just literally come into the office, and what they're there for, we go ahead and address, and we spend as much time as we need to, or as little time. So they can come on their lunch hour, they can come whenever's convenient for them, and it's actually incentivized them to use their healthcare more. So that's been a really nice surprise. I'm seeing more of my patients now.
Yeah, and that's you hit on a point there about the transactional. I call it transactional fear. Mm-hmm. And one of the background of this show is actually living in Panama. You meet people from all over the world, and you just said something that a friend of mine from Spain has told me quite a few times, actually, in our conversations about healthcare. In 1986, they started their first primary care clinic in some town. But they made the decision to focus on primary care as the Ministry of Health there. And now they have over 13,000 clinics.
Whoa.
So, yeah. Oh, yeah. Well, there's things now that are happening with that. But he says, I just go to the doctor. I don't even think about it. And it's exactly what you're saying.
Right.
And so you catch things sooner. You don't have that transactional fear.
Right.
And it's brilliant because that's one of the things that people love about quote unquote single payer, nationalized health systems that we're having this debate about. But one of the real key issues is you're able to go to the doctor, and get care and not think about how much is this going to cost? I mean, what's are they going to nickel and dime me? I mean, it's brilliant.
You did touch on something that I would like to kind of, you hit some target words. I just want to kind of address. Part of the reason why it's less transactional, like it can get in and it's easier, is because you've taken some of those regulations away. So when you say nationalized healthcare to an American, with our elections coming up and with people thinking through a single payer healthcare system, I think that there are some very positive thoughts toward having government kind of just take control. But then what we've seen thus far is that government tends to make more regulations and it actually makes it harder and they come between the patient and the doctor. So I think that the direct primary care, given the relationship between just the doctor and the patient and pretty much leaving a lot of the bureaucracy, a lot of the administrators, just kind of leaving the third party payers, all of them out of it and making it just between the patient and the doctor is really the best way to go.
Yeah, I think part of this is that people hear the word healthcare and some people hear coverage. A lot of people hear coverage and some people hear care, but we're not all on the same page. And I learned that living here because you get people from all over the world. And what direct primary care is really proving is that you have the ability to handle a whole lot of issues with comprehensive primary care, which is not in the old system.
Right.
And so where you maybe want some additional help is for people who can't afford to get a huge, they can't afford the insurance for the catastrophic care.
Exactly.
Where things really go wrong, accidents, cancer, stroke, heart attack. But the thing that really blows people away is when I explain, look, all the things that between heart attack, stroke, preventing diabetes, those things, the chronic care, it's so much more preventable in that model. And therefore, you drop a lot of the expensive patients down into direct primary care. You're saving a lot of money and giving great care.
Right.
And that's terrific. We can agree on that. There's a lot of agreeable things that people get over what's my copay? What's my deductible?
Exactly. And really to access the rate with direct primary care is access with continuity. And that's what's really important. I think a lot of the corporations and policymakers and everything, they really try to make us accessible, but they go about it in a roundabout way. They want more appointment times. They want shorter appointments so we can get more people in. But unless you have that continuity where you get to see your own doctor, then access without continuity is actually a very low value. So what direct primary care is, it brings value back to the healthcare visit. So the only time you want access without continuity is if it's an emergency situation, right? So if you get into a car accident, you don't necessarily need the doctor to know you to be able to treat you for something that's an emergency. But for 80 or 90% of your primary care, you're going to get a lot more effective care, and it's going to be more efficient and catered and tailored, personalized just to you.
I've been looking at issues like continuity of care and I mean, as I said, I have direct primary care and I absolutely won't go back to the old way of doing it.
Right.
And I know there's a certain amount of education for people new to DPC and they're preconditioned to look for certain things.
Okay.
And, how much is the copay? Do you accept insurance? And they're coming from a dysfunctional system, and they don't know the right questions to ask.
Exactly.
Ignorance is a tough taskmaster. So what should they be asking when they come in to see you?
One thing that they should be asking about is, how accessible am I going to be to them? If I'm their doctor, does that mean every visit is going to be handled by me? If I take a vacation or if I'm away, what happens then? Am I still going to be available to them? Am I available to them after hours? Am I available to them for advice? If they don't want to necessarily make an appointment to come in, that kind of question those are really powerful questions. And you get the answer with direct primary care is that, yes, I am available. Yes, I'm still going to take emails and calls, and it's going to be very few times that you will not be able to get in touch with me, but you will have a lot of communication. You'll be completely aware of everything. There's no barriers in between us as far as there's not a call center making your appointment. There's not an assistant who might not know my particular schedule. It is me. If you call the office, you're going to talk to me. If you email, you're going to email me. So I think that piece of it is very important as far as direct primary care goes. I think another question, I don't know if it's necessarily a question, but a lot of people, when they're asking me about the direct primary care model, is they say, well, I only go to the doctor once or twice a year. And that's a frustrating statement, because I think that's in this dysfunctional system. If they had a good healthcare system, I think they would utilize it more. So I want to say, well, but if you could, and it wasn't an inconvenience, would you go more? Would you maybe ask your doctor for advice more? Would you, if you didn't have to necessarily go to the office to get treatment, if you could text me and tell me your symptoms, and it was something minor and simple that I can call something in, would that be of value to you? And I think people, if they think about it that way, it definitely is valuable. I think it's just they're kind of coming at it from, like you said, from modeling after the dysfunctional system that we know does not necessarily work or add value to their visits.
I would point out too, and you're absolutely correct in my opinion, and I'd also point out that medicine itself is changing, and medicine has gotten more personalized. You, as a physician in primary care, are the one connecting all the dots. So if they have a Fitbit or they've got an Apple Watch, where's all that data going? Who's actually monitoring it?
Right.
And the way a lot of people do it now, they go on Dr. Google, and then they'll pick a specialist based on something on Dr. Google that they read. If you have a direct primary care doctor, you just send them a text and say, should I be worried about this?
Exactly. And I actually have an electronic medical record that lets you input your Fitbit information and some of those products that you're talking about. So we can actually talk about it at the visit if we wanted to.
And it's also things like diet, exercise, and the stress. Everyone's different. There's no more cookie cutter medicine.
Right.
And I think millennials are starting to catch on to that, I'm not too sure about all this. I think maybe it's a good idea to be able to touch base with a doctor, but they're now using apps like ZocDoc and others to just get to a doctor.
Right.
And it's something you touched on earlier, which I warned them, and that is you still need a focal point for your care.
Right.
And someone who's connecting all of your medical dots. And I'm going to touch on that in a minute. So aside from financial things like why you don't accept insurance, which takes a lot of time out of the relationship and paperwork, what makes the light really go on? When do they get it? Is there one kind of thing, or is it just a series of things?
I think after that first visit, they're starting to get it, just because, again, the way it's presented to them with a beverage and relaxing, and we have a separate intake room, then there's a separate exam room. So, they're there at least an hour. And I was always such an efficient doctor. Like I said, I like to see people when their scheduled time was, which meant that I had to not necessarily rush through appointments, but I did have to keep people focused. Now it's so unhurried that they spend a lot of time there. and we talk through every single issue they have. And the way I can tell that they're getting it is as we leave, I walk them to the door, I'm getting hugged by about 80% of the patients I'm seeing. And now I did just, open 3 months ago, and I've gotten hugs through my career, but that's a big percentage. That tells me they really are happy. And these are people that I've never even seen before, but they're hugging me for it. It's just so rewarding. It's such a great experience.
The internet connection broke up there, but I think even the listeners will get the memo that, have you hugged your doctor today is not something, says no one ever in the current system that people are in.
Occasionally you get it, but it's very rare. Yes.
Yeah. I have to admit, I have not hugged my doctor. I shake his hands, but it's so.
I think that it's because I'm getting people through word of mouth that they can't believe it. They've been pushed through the system that we have that really does just sort of ignore a lot of issues that they have. They don't have time to bring it up, and they're just so thankful. And they realize she just gave me her cell phone number. I mean, they're amazed at that. And it used to be commonplace for that to happen, for you to have that kind of relationship with your doctor, but it's just getting further and further away from that now, which is just really a shame. So I'm really happy that direct primary care kind of brings it back to that.
It's the old-fashioned medicine.
It's the old-fashioned medicine. And it's the old-fashioned medicine with technology, which means I can do the old-fashioned direct care from someone that's maybe even 3 hours away. If they're at college, I'll make an appointment on a Saturday, but I can still text and email. So we still have that relationship going. I still know what's going on in their life. But because of technology, they don't have to be within a 2-mile radius of me.
That system, when you talk about someone being 3 hours away. And by the way, we're here with Dr. Melissa Jones of Priority Care in the great city of Charlotte, North Carolina. And I picked up Dr. Marty Makary's best-selling book, The Price We Pay. Mm-hmm. And the very beginning of it has a hospital story. There was a patient from France, and he was visiting his son for a college, parents' weekend. And he had a problem with his heart, and he was in the hospital. And the next morning, he had suffered an event. And the next morning, they said, well, a rep came in and said, you're going to need a heart bypass within the next few weeks. That's what the doctors told him.
Oh.
And so not long after that, one of the financial reps came in from the hospital and said, well, the price is $150,000. And when would you like to do it? And of course they went, huh? What? Well, let us think about this. And so, okay, fine. I'll come back and visit you. So the second time, now they called the doctor in France who because the man is from France, he lives there. Uh-huh. And he was told by his doctor there that the same operation would be $15,000. And so they went, So the person came in, the rep came in, and they told him, hey, look, it's sort of, he dropped it down to $50,000. And they went, huh? Well, what? Well, yeah. And they're like, no, that's okay. We're going to, figure this out. Rep leaves. As they are leaving the hospital, the rep came up a final time and dropped the price to $25,000 as they were walking out the door. Huh. And so that was the way the book started. And the patients, the entire family loved the docs. They loved the physicians, but they were really put off by the business side of American care. And who can blame them?
Right.
But it tells you, wait a minute, you just went from $150,000 down to $25,000.
Right.
Well, what happened to that 125 that magically disappeared?
Right. You need transparency in healthcare costs, definitely. Yeah.
Yeah, that'll really help. That's really going to help. And by the way, that story is in the first Amazon's free peek inside, so you don't even have to buy the book. Although it is a great book, and I would encourage people to learn from it. And do you have any similar experiences along those lines in terms of getting prices from some outrageous number down to something that's more?
Well, not quite 150,000 down to 25,000. This is outpatient, but yeah, it's still significant enough for the patients that come to see me. For one example of this is I had somebody, and she has insurance. She had her labs done with me. I think it was $6 for the initial workup. There was an abnormal lab value, and so I did some follow-up labs. It was standard of care is what I would do with anyone that had the abnormal value. There was a mistake, and they went through her insurance, and I called later to find out how much they charged her. They charged her over $500, and then she has what she calls good insurance. So the good insurance paid over $400 of that. So her out-of-pocket cost was $70. So in her mind, the doctor ordered $500 worth of test, right? So she has good insurance because it covered a lot of it. If she had just done cash pay with me, it would have been $10. And that's just ridiculous that the insurance would inflate the price that much. And then only, because you don't know how much they're actually going to cover. You never know what the real cost of what's being done to you is. And I've only been open 3 months, and I'm already seeing examples of this, and other direct primary care doctors that have been open for years they have story after story after story of the system taking advantage of patients because of the lack of price transparency.
So you left a big system almost a year ago now, back in February, right?
Right.
And in terms of patient care, was it a single moment or a combination of things to make you say, take this job and have a nice day?
Right. So definitely a combination of things. The access to care and that personal relationship with my patients was a big deal to me. And I had no control over my schedule or ability to enhance those relationships. Just to give you an example, when you're an employed physician, the panel size is typically around 2,500. And because I was in an office that had other doctors, I would a lot of times have to see their patients, which was fine. And it's an adequate visit. But I really wanted to focus on my patients and build my patients' relationships so that I could treat them more effectively. And direct primary care really brings that doctor-patient relationship as the most important. So it's relationship, people over profit, I suppose. So the access with continuity was probably the biggest reason.
And there's something that you mentioned to me in one of your emails, and you mentioned that people say to you, my doctor just left and I don't know where they went. Old patients cannot find you. And I'm sure it's frustrating for them. And what patients may not know, their physician feels the same way. And the thought occurred to me when I read that, the question that came out was, what prevents you from reaching out to them?
Well, we have something that's called a non-compete. So we are actually contractually unable to reach out to our patients. There's also a lack of access to the patient information. So while I had given my phone number to a small subset of my patients, I didn't have any way of getting in touch with the majority of them. So, and if they call, they're going to get a call center, which doesn't even know that I'm still in Charlotte. They have no idea what happened to me because it's impersonal. It's not even the office. So there's really no incentive for the hospital to help them to find me, even though I'm not huge in competition. It's still, patients were just in the dark. They were upset, they were angry, and there was no one to help them. And that happens a lot more frequently than you would even realize. Sometimes a doctor is trying to make things better. They're not trying to leave their patients. They're trying to make things better for their patients, but without in the opportunity to communicate with their patients, then sometimes the relationship gets severed and unintentionally, and they don't really mean for that to happen.
So now patients are playing Where's Waldo with their former
Exactly.
doctor, with whom they have the relationship
Exactly.
with.
Exactly.
Yeah. Why, you're going back to something that's so important, and I want to touch on this again. And why else is continuity of care so important? What does it really mean to patients?
Well, it's if you think about it, people are so different. You could have the same diagnosis, but the way we approach your treatment would be if I were to see someone else that had another doctor, if I didn't know the treatment plan, then I wouldn't necessarily be effective in continuing whatever they had done with their prior doctor. Does that make sense? It's hard to explain, but that personalized care is so important because you build on the relationship. So you're not just understanding a patient from one or two visits or from what's in a chart note or what's in a computer information. You're understanding them from their personality. You're understanding them from their family members, their barriers to care. You know a lot of different facts about them that help you make decisions in their healthcare. So it's kind of, you have the science of medicine that you trained so many years for, and then you have the art of medicine. And the art of medicine is really important, and you can't practice the art without the relationship.
That's a great line. That really is a great line. I mean, if
I
you just
did.
made that up, you're brilliant. Brilliant. It really is. I'm glad we're recording this because I am definitely gonna use that because it makes so much sense. It is the humanity part of dealing with patients. And I'm not a doctor. I'm a guy who was very fortunate to have some really great medical mentors, and they instilled in me that the relationship is critical, and you need time for that to develop. You need that human connectivity.
You're not going to get those types of information from a chart, no matter how extensive or how many notes someone takes on you. It just does not even come close. It doesn't compare.
And there are some serious continuity of care issues with hospitals dealing with personnel changes reaching all the way to the operating room. And I know here in Panama, we had a respiratory care group that had this issue. And I'm also thinking anesthesiology doctor groups as a couple of examples. And I know enough to be really concerned about this. So if I go in for surgery, I'm going to be asking some questions, mostly due to my aviation experience. And it's human factors. And in human factors in aviation, communication is the number one issue. Are we on the same page? So the questions that I would ask are, how long has the surgical team been together? Will it be the same team doing my operation? If not, why? So those are two that I've thought of that if it ever happens to me, I'm going to ask. So are there any other questions you think we should be asking in that situation, and why?
Well, I definitely think there are questions that you could ask and would help you know. I'm not sure that you would get the answers because healthcare is not as necessarily transparent as we would like it to be. But you would want to know, how long has the team been working together? Is there turnover? It speaks to how they're able to care for you, if they can work together well as a team. If they do work together well as a team and they're supportive of each other, that means that you're not going to have a lot of turnover. You're going to get better care just because of how they work together themselves. Again, I'm not sure you're going to get your answers if it's a situation like that, but definitely that would be something to consider.
You're definitely going to put them on notice that you're not just, you're not an uninformed patient. And the thing that perhaps a lot of people might not realize is, well, let me ask this: how do you fit into that scenario as the patient's primary care doctor? And how do you fit in if something happens like that? It's one of your patients; they're in the hospital. How are you able to handle that situation as compared to the old system where you were in a 2,500 panel practice?
Right. So something happened with one of my neighbors this week, and I know I can mention it without, privacy issues because she put it on Facebook. But basically, she had an event. It was very scary. She had to go to the ER. So I'm texting her doing this. I'm saying, okay, whenever a doctor comes in the room, if you have any questions about what they just said, please let me know. Bring me in, no matter what time of eating this is. Let's talk about it. Let's figure out what's going to happen in the future. Let me know how I can help you in any way. So I think that's how I can be there for my patients, even when they go into the hospital. Ideally, I would like to go, if they have a prolonged stay, see them in the hospital. But no matter what, technology enables me to be just a text or a phone call away, so that if there are questions, and just if they want somebody to kind of coordinate their care, I'm available for them. And I want to do that. That's part of what I like to do as primary. I want to treat all of their issues and be the medical center home for everything that's going on with them. So it was good this week to have that. And I've been able to kind of check up on this particular patient every day since, just to make sure, just to keep the follow-up going. And you don't really get to do the follow-up when you're so overwhelmed in a big system and have so many patients. You want to, it's just not practical.
Yeah. And it makes sense if let's say I'm in the hospital and it's an emergency and I'm unconscious. It's great that if a family's there, they have access to you as well, because you can fill in the team as the focal point for care. You can say to your fellow peers, your doctors, the doctors there, okay, this is what the patient is. And by the way, when he wakes up, he's going to be angry and he's going to be grumpy because that's who he is. So, I mean, that's that human factor again, that communication.
Right.
And if people wonder why there are malpractice suits, the number one driver for malpractice suits is communication.
Right.
That's a big deal. So there's more reassurance here. There's less FUD factor, fear, uncertainty.
Right. And that brings something else up as you were talking that I kind of remembered. When you're in a situation, and especially if it's been a bad event or an adverse event that's happened, you're not always thinking of everything that you wish you could, and you remember things later. If I come along on the back end, then you're able to say, hey, I'm in pain and I forgot to mention it. Maybe I can call you in something that would help. Or I think one of the, I just offer tidbits. This over-the-counter medication will not interfere with the prescription you were given. Go ahead and take it with it, that kind of thing. And if you don't have that continuity or that, nobody would. I mean, it's an emergency type situation, but if you have a doctor that you can have follow through all the different steps of your care, then you can ask those questions later, and not be, kind of kicking yourself wishing that you had remembered at the time.
One of the promises of EHRs and, sharing electronic health records, and I remember reading about this, that a big deal was like an ambulance, a paramedic in an ambulance would have access to your private records. And I'm thinking to myself, I understand in the old system as it was going downhill, as time with the patient was being eroded, which is happening in the National Health Service right now.
Right.
It was okay. Let's use technology, the ponytail and sandals crowd, as I call them, who developed these technology solutions without really asking anyone if, how are you going to use this? Part of it was you didn't have access. You couldn't call the doctor on the phone and say, hey, I'm in the ambulance and he's got this thing on the cell phone. It seems to me with direct primary care, you don't necessarily need all that technology all the time. All one has to do is talk to you and you answer the phone.
Right.
So they're getting the actual person who knows that person the best. You'd know the allergies. You'd know what medications they're on.
Right.
You would know their history. You would say, okay, this is what you don't do. Whatever you do, don't give them this.
Right.
kind of thing.
Right.
And so we can reduce the reliance on electronic health records, and there's a reason why I bring that up. Direct primary care has an inherent privacy advantage.
Right.
Meaning no one's looking at patient records without the patient's permission, is one example, unless it's, law enforcement coming in and, that kind of thing.
Right.
Because there are HIPAA regulations. So what do you think happens to care if we lose that expectation of privacy between the patient and the doctor? What is that going to do? What's that do to you? And what happens to the patient?
Right. So people aren't as open about issues. You can't really open up if you're not trusting that what you're saying is going to be just between you and your doctor. With direct primary care, I can assure every patient that it definitely is going to take into account their privacy as one of the number one priorities. With my electronic medical record, I can communicate with the hospitals in the area, but they can't get into my system. So it's still that technology of having everything at a fingertips away in the computer type thing, but there's not a lot of people that are going to be accessing their chart because you don't have the front desk people, right? You don't have different medical assistants or different lab people. So really it's just me and their chart. So unless they tell me they want to share their information, I don't need to share it, which means that they feel very comfortable going ahead and telling me any and everything because they know that nobody else is going to find out about it.
And because you don't take insurance and you don't take Medicare, you don't have auditors coming in.
Exactly.
With thumb drives.
Right. Third-party players also don't come into play. That's a very good point. You can't help. It would be fraud if you didn't put a diagnosis down that you discussed or that you were billing for, and you can't hide those codes. They follow the record. So that brings in a whole nother department, billing people that are going to know maybe not the details of your diagnosis, but still they're going to know your information, your health information. It's not going to be secure.
What you diagnose, meaning you're taking in information to make a diagnosis. So that goes into a record. And then from that information, you're making a diagnosis and you come up with a treatment plan. And at some point, an auditor in the old system is going to be looking at some of this and saying, oh, really? Okay, well, yeah, privacy is a big deal. And this is something that, in my opinion, it is the thing that that all doctors can certainly agree on, and something that patients really need to spend some time pondering.
Right.
And it's not, I don't have anything in my health record that I'm embarrassed about. But you know what? I have friends that, yes, if it got on the internet, they'd be mortified.
Right.
So that's a big deal. That's a huge deal.
Well, even then, too, as you're looking at insurance companies, if they can find any reason to deny a claim, a pre-existing condition. So even if someone put something in your chart that was, you're thinking of ruling out a diagnosis, but it gets put in your chart as the diagnosis because you're ruling something out and you don't actually have it, you could still be dinged for that down the road. They won't cover you because they're considering a pre-existing condition. There's all kinds of scenarios where it just can be bad for you. I don't want to, cause a panic, but you're right. All of your healthcare information, who had access and what they're putting in there, right?
DPC is very safe in that regard, and that's enormous. Thank you for your time. And Dr. Melissa Jones with us from Priority Care in Charlotte, North Carolina. And I want to touch on something, businesses in your area. They're just getting the memo, and most don't have a clue about the cost savings. And so what kind of businesses are you talking with? What intrigues them the most?
So small businesses lend themselves very well to direct primary care. Bigger businesses do too, but as I'm starting out, I just want to make sure that I have all my ducks in a row. So small businesses are kind of my focus
Sure.
right now. And as you know, I mean, businesses, they want to know, how can we make more money? That's one of their very first goals. And with direct primary care, I can have personalized care for their employees. I can tailor my equipment that I buy and that I have access to issues that their employees might have, workman's comp issues and injuries, that kind of thing. So that's going to make an efficient employee, a happier, healthier employee. So they're not going to miss work as much. So that's going to save the company money and actually make them more money. And then saving money. I don't think there's any insurance plan or any kind of benefit that's like direct primary care. I mean, it's really so cost effective and affordable that I think any business would look at it and say, okay, well, what's the catch? Because this is definitely saving us money. If they can get their mind around the actual concept of DPC to begin with. And then you're preventing problems because you've got a doctor that comes in and says, this is, I'm going to do a health fair for you. I'm going to go ahead and get some of that preventive medicine done too that your employees might not have thought about. So even in the long run, we're going to keep them healthier, not just right now and for the next few months and the next few shifts.
I'm going to give you a scenario.
Okay.
So an employee wakes up one morning with a sick child. The old way meant calling their boss and explaining the situation, then going to a trip, to the doctor's office, assuming they can get in. Otherwise, they're going to the emergency room, losing a half day or even a full day from work. And I mean, a sick child is stressful enough, but if you're a single mom and you get enough of those days on the record, or any employee, but especially a single mom, put yourself in those shoes. Bosses might not be so quick to promote them. And that's going on in their mind, whether their boss can be the nicest person in the world. They never think that. But, what goes on in the employee's mind is something different. So that becomes a suppressive influence. Do I make the call? Don't I? And we're going back to transactional fear. And so DPC helps reduce or eliminate those issues. And that...
I've already seen somebody because he texted and said, I have a lump on my throat. It's probably nothing, but can I stop by on my lunch hour? And he did. And it was a 5-minute exam. I gave him some reassurance. We kind of discussed what sort of things to look for if it was going to get worse. But otherwise, he got his reassurance and he left, got back to work, didn't have to take any time off. Like I said, it was during his lunch break. And I wrote a short note and it was done. It was easy for me too. So he got high value care and I also felt rewarded with the experience. So you're right. The direct primary care just kind of takes a lot of the stress that's related to your healthcare. It just really brings value to that healthcare visit.
And correct me if I'm wrong. I think there is a county in either South or North Carolina that did this for their county employees, and they saved something like $1.5 million the first year.
That would probably be Anderson County. Dr. Shane Purcell. I don't remember the exact name of their clinic, but yeah, they have a contract with the county and they're seeing all of the employees and it's really working well for them. They're actually busy enough that they're trying to look for another doctor to come join them. But it's going well.
Wow.
And I think they've already tried it and they've decided that this is what they want to stay with. Because, the employees do have a choice. They don't have to do the direct primary care.
Right.
And most of them are now choosing direct primary care. They're seeing the value of it. And there is also a city in Florida that Dr. Lee Gross, he is working with the hospital CEO and he's seeing all the hospital employees. And I think that $1.2 million definitely is a savings cost that CEO had emailed him about. So we're seeing that this small, innovative model is actually scaling. I mean, it doesn't have to remain small. It keeps that doctor-patient relationship there, but it can work in a bigger vision. It doesn't have to just remain little pockets of care here and there.
Right. Do you see the irony in what Lee Gross just
I
did down
do.
there?
He's
For
pretty
you, I
amazing.
mean, a hospital saving 1.2 million, having their patients, having their employees.
He showed us
Excuse
the
me. Well done, Doc.
he showed us the email because you're right. It was are you kidding? It was one of those type of moments, but that's a huge success. That was
Brilliant.
just, it's brilliant. Yes.
Well, I know businesses want to save money, and that's so true. But the really smart managers, and we're gonna wrap this up shortly. But the really smart managers I've come across in my 60 years in this planet, the really smart managers, they all know they have one employee that is the problem solver, or they prevent problems by their
Right.
existence. And actually, preventing problems is probably the hardest thing to quantify in a business. Because the problems aren't there, there's no white knight needed to come in and solve them. They don't
Right.
appear. So, but every business usually has one or two people that are like that. And you want to keep those people as healthy as
Right.
possible, along with
Right.
everyone else. I mean, this is a no-brainer. If a business just sits down, and an owner, because you're dealing with small and medium-sized businesses, if they just sat down and thought about it, it's just gotta make sense.
Right.
But the problem is they're stuck in the old system too, and so it takes they need a share snap out of it.
Right. I have one business that I'm talking with that they utilize urgent care quite a bit because things happen quickly on the job. They work with dogs, so a dog bite here or fall or slip or fall. I can save them money because I can go ahead and have when I was mentioning earlier, equipment, I could also have the relationship with a facility where they can get the imaging for cheaper, but have it ready to go. So we know those problems are going to happen. It's just having the plan in place for when they do. So you're preventing them from going to an expensive urgent care visit because you have this direct primary care physician ready to help right then. That's a huge benefit to them. It's going to save them a lot of time and money, and it's also better for the employee because what I'm hearing from some of the employees is that they sometimes don't go to the urgent care because of the bill. Sometimes the owner can help offset the bill and sometimes they can't, but what happens most of the time is they just wind up not getting care. And if they have the care available, again, direct primary care actually incentivizes you to use your health care. And I think that's a big win for employers as well as the employees.
Wrapping up the show with Dr. Melissa Jones of Priority Care in Charlotte, North Carolina, what a pretty town.
Yes, it is.
And you're on the web at melissajonesdo.com. Love that domain name.
Thank you.
Again, gold star. We'll have that in the show notes and in the description. And, a couple of things that when I think back, I made some notes and that I really want to say well done. And that's waiting time, that you feel that you don't want your patients to wait. And now the model you're in enables that.
Right.
And then that preventing the transactional fear, just come in and just call, just text.
Right.
And then the thing that said no one in the old system, that you're getting hugged by the majority of your patients.
And I'm not exaggerating on that. I'm not.
That I believe it. I believe it. It's just because I think people are so frustrated,
Right.
It's such a relief. And oh my God, I've lost the fear, uncertainty, and doubt about where my health care is going. I've got someone that I can rely on. That's priceless.
Right. It's bringing the joy back into medicine for both of us. It really is.
And you just said a mouthful there with it's a joy for you too.
Yes.
And who doesn't want a happy, healthy, wonderfully challenged, and intrigued physician that loves probing things and connecting dots and is happy in what they do instead of being depressed. And you want a doctor that loves what they do.
If the doctor's happy, you're probably going to get excellent care.
Yes. Well, I wish you every success in your practice. And
thank you.
Thanks for joining me, Dr. Jones.
Thanks for having me.
Well, to my listeners, thank you too. We do appreciate your time. And that's all for now. Please join me each week as we take a deeper dive into aspects of healthcare you won't find anywhere else. And there you are. Thanks for listening to the Winning Healthcare Food Fight Show. Hit the subscribe button to hear more expert thinking on getting better care without the mess.